Founded in 1979, Benson Health has been a critical provider of primary care services to patients in 3 rural counties of North Carolina for over 40 years. With 4 physicians, 3 physician assistants, a nurse practitioner, and a clinical pharmacist, we are the primary care provider for more than 10,000 residents of our community. And as our tagline says, primary care for everyone, that is reflected in the racial, age, and socioeconomic makeup of the patients you will see in our waiting room. So what has allowed the success we have achieved so far in providing COVID-19 testing? I think that any success can be attributed to 3 things: clinical leadership, established relationships, and adequate funding. It all started for us with good clinical leadership and the passion to see that we were able to give our patients access to testing. Let's hear from our medical director, Dr. Eugene Maynard.
What propelled our urgency in getting testing up and running for COVID-19 at Benson Health was that our patients really had no other opportunities to be tested. There were basically no resources in the community for testing when we started our testing program, which was within a week of the first case happening in Johnston County. We did have some issues, some problems at first. One was getting the needed supplies. At first, there were shortages in PPE, there were shortages in the swabs, there were shortages in testing materials, transport media. But we were able to work with Quest Diagnostics to get the materials that we needed to be able to do the testing here, and we were able to ramp up fairly quickly with that testing. I think at no point from the time we actually started testing did we have to turn someone down because we didn't have what we needed to do the testing. We did then develop a different problem, which is that there was a long turnaround time for the test. So we also worked with Quest on a prioritization program that they had so that at least our sickest patients or people who had high-risk jobs could get results back more quickly so that we could have the situation be as safe as possible for them and for anyone that they might come into contact with. We also have worked with the North Carolina Farm Worker Project over the last 14 years doing farm worker clinics every Thursday night, but this year that had to be very different because of the COVID-19 pandemic, so we had to take our clinic on the road out to the camps in order to be able to meet their healthcare needs. Also, that was really the only way that we were going to be able to do significant testing for them for COVID-19. Our farm worker patients are very high risk for spread of COVID-19, and they don't have a lot of resources to help them combat health issues. We're really their biggest resource for that. So we had the availability to take the testing out. We also worked with the North Carolina Farm Worker Project to develop a safe mobile clinic that they could actually use to do testing even at sites we did not visit. So we acted as a consultant for them on that, which has really allowed farm workers to be tested in our area better than I would have expected them to be able to be tested.
Having an established partnership with Quest Diagnostics, which operates a patient services center in our facility, certainly helped us in getting the needed supplies, as Dr. Maynard has stated. From the start of this pandemic, when others were having limited testing capabilities, we were able to test those who needed testing without restriction. Having a safe place to conduct testing while protecting the patients and the staff located inside our facility was critical. It has been a part of the reason why we have not had a positive COVID case within our team here at Benson Health. As we look for a place to conduct our COVID-19 testing, we had access to a loading area at the back of our building, which was perfect for cars to enter for testing from the vehicle. but this space did not have any covering to provide protection from heat or rain. So we were able to use some of our funding to construct this awning at the back of our building, which allows for us to conduct our testing Monday through Friday, 8 until 5. As we plan the potential of having to move the testing inside during the winter, we have a conference room with a self-contained heating and air system, which could be revamped for testing inside. We have purchased an air purifier, which is currently used in our lobby. This device will be repurposed for indoor testing in our conference room. This device is listed as being able to remove the COVID-19 virus from the air. Let's hear from Dr. Amanda Stevenson, who is working in our COVID-19 testing area.
Hi, I'm Dr. Stevenson here with Benson Health. Back in our COVID triage area, we have been blessed by the rural health department and have some funds available to ensure that our rural patients down here in Benson and surrounding communities can have access to COVID testing. It's important to have this access so we can prevent the spread. So when people are exposed, they have a place that is within their driving distance that they can come get a test, and we're happy to allow them that access and assist them with that testing.
Partnerships are critical, and as Dr. Maynard has stated, we have had a 14-year partnership with the North Carolina Farm Worker Program. With funding we have received this year from a grant from the North Carolina Healthcare Foundation with their Fill the Gap program, we have taken our farm worker clinic, which was previously held within our facility on Thursday evenings, out to the farm worker campsites. Let's hear from one of the key team members from the North Carolina Farm Worker Program.
¿Por qué es importante? Why is important?
¿Por qué es importante?
Come here. Es importante porque ellos no tienen quien los ayude, ni con doctor, ni con pruebas de COVID. Ellos trabajan desde las 7 de la mañana hasta las 6, 7 de la noche. 7 in the morning, 7 night. And ellos no tienen quien los ayude. Entonces, por eso es importante que nosotros vengamos al campo a ayudarles, porque ellos no pueden ir a ningún lado.
We have provided testing for over 1,000 people in our community with a positive rate of greater than 11%. We do this regardless of ability to pay. We provide this service to everyone, regardless of whether or not they are a patient of Benson Health, and we provide it consistently 5 days per week. Without the funding from HHS, the North Carolina Farm Worker Program, the North Carolina Foundation, and our partnerships, none of this would be possible. So how have we used the money from HHS for COVID rural health testing to ramp up and provide over 1,000 plus COVID-19 tests? The purchase of PPE to protect our staff and patients. The construction of an awning to provide a safe and comfortable place for 5-day-a-week testing under all but extreme weather conditions. Covering the cost of testing for anyone without insurance and not qualifying for free tests. Paying for the cost of staff to document the testing and reporting along with the follow-up to patients on the testing results. Without these partners, and most of all, our dedicated team of providers and staff, none of this would be possible.